welcome to Check In and Check Up for Your Health as we are empowering ourselves and those around us in this Wellness Health Summit. I am Sybil Wilkes, and joining me today is Dr. Stacie N.C. Grant. She is the International President of Zeta Phi Beta Sorority Incorporated. Dr. Grant, thank you so much for joining us. And by the way, what's that NC for?
Now, if I tell you, I might have no. It's my it's my middle initial and my maiden initial. I didn't want to hyphenate my name, so I'm the only Stacie NC Grant on the planet. So I am thrilled to be here with you and excited about this wellness summit and an opportunity to really empower the chief medical officers of every community and family, which are Black women. And we know if you want a job done, you give it to us. But the fact that you've invested the time in bringing voices together around such a critical topic, I applaud you and thank you for all that you do for our community, keeping us informed, engaged with the resources and the information. And anyone who is watching, I hope that they're sharing this show and all the content that you provide.
Thank you so much. As you did say, our mission is to foster and to elevate women's maternal health and talking about the pivotal role that we all play and assuming as chief medical officers within our lives and within our families, as well as you know, as the leader of such an incredible group of women, a leader in the community overall. Dr. Grant, you have been the international president of Zeta Phi Beta for we're coming up on 2 years now. Is that right?
That is right. I am proud to be the international president and CEO of Zeta Phi Beta Sorority Incorporated. Time definitely flies when you are having fun serving. And July 2022 is when I took office. And as we're preparing for our international convention, I'm excited about the way in which we create impact. Our theme or focus area, if you will, is if Zeta's embracing the extraordinary power of she. And that is our advocacy around social justice, health justice, and economic justice globally. So this conversation today is really a health justice conversation for me and for our organization because we take the matter of maternal health seriously.
And you do. I mean, you have events that you all have scheduled throughout the year as you address the issue of maternal health, and of course, all of your how many thousands of members do you have at Zeta Phi Beta?
Oh, close to over 130,000 members in almost
Okay, so
900
that's
chapters across 12 countries. And we have taken the lead in the area of maternal health because for over 50 years, we have invested in our women's health and maternal child health through our partnership with the March of Dimes. And that addresses how we are really able to counteract the poor birth outcomes in our community. And we assure that better health is given prior to pregnancy, like the things that we need to be concerned about, and then the early onset and continuous prenatal care. And we've updated our program that we are known for with Stork's Nest, which is an opportunity for us to help these young mothers be able to be healthy carriers of life and
yeah.
taking care of themselves because we know about maternal morbidity. And the work that we do has been at the forefront of this conversation for a half a century.
And so let's just extend that a little bit more because you are already sharing, and that's part of my question. And how you all are doing this. How are the Zetas empowering women to take on the role of chief medical officer within their families, and especially as we talk about the difficulties and the disappointing numbers regarding Black women and maternal health?
Absolutely. So, what we have done in our partnership with March of Dimes, we've created the Stork's Nest. And the Stork's Nest is an opportunity for us to have those education programs and to be able to help new moms schedule postpartum visits and follow ups. It's resources that those who participate in our Stork's Nest can come and physically walk away with clothes, with diapers, with
Mm.
milk formula, but also be able to get the education around how to take care of themselves through the process of giving birth, and then also what to do post birth, right? There are a lot of things that we don't talk about. And I remember going through Lama's class. Let me just use a personal example.
Hmm.
And it was my first child. I signed up for the class, and the instructor said, we always have one couple that never makes it to the end. So here I am in my brilliance. I'm like, well, that won't be me because my due date is so far after this class ends that I'll be fine. I was the one, Sybil.
No.
So I missed the last sessions of the class. So when I was actually in labor and delivery, I
Hmm.
didn't realize it was two separate events, labor and
Oh,
delivery. It
sure.
sounds very nice when you combine it, but for every mother that's listening, you understand the difference. I didn't get to the end of that class to realize that I had to save what other little bit of energy I had left for delivery. And it's comical when you talk about it, but it's serious when you think about that's where we
In
lose
the real
moms.
happening, in the experience, it's totally different
Absolutely.
than the concept itself. Absolutely. Oh wow. Bless your heart.
Absolutely. And it's that kind of education, right?
Right.
To know how to feel what's happening in your body, how to be able to advocate if something is wrong, because no one knows your body better than you. And that's the challenge that we are faced with as a community, and the work that we do to educate through our Storks Nest program is to really help mothers and new moms understand how to track what's happening with their body and to get access to the information about maternal health hazards that could occur with their blood pressure. I mean, you name
Right.
it. It should be one of the smoothest processes on the planet to deliver a child, but it's one of the most complicated. And if you don't know how to advocate for yourself, if you don't know what questions to ask, it makes it difficult for you to be able to have a successful pregnancy. So our Storks Nest program not only educates but provides space for the new moms to ask questions, to hear from other medical experts, to explore maybe they might want a doula instead of being in a traditional hospital. They might want to go to a birthing room. But all of these educational opportunities help us to empower women to take control over what's happening best they can, because when that baby's coming, nobody can control it.
That's
But to
right. That's right. It has a
understand
mind of its own at that
how.
point. Right.
Exactly. And on the healthy lifestyle and habits that prepare them for motherhood, learning if they want to become a mom that nurses. What does that mean? How do you get that support? Something as precious and intimate as nursing your child, you need support. The first time around, I almost lost my mind because it wasn't happening properly for me, and there was
Hmm.
no one to support me except my husband going frantically crazy. He was like, just quit, get the bottle. This is too much. I had ice packs and everything. He was like, just give up.
Oh.
I was like, no, I'm going to nurse my baby. But it's those sorts of conversations when we talk about maternal health, when we talk about pre, during, and post.
Hmm.
Those are the key areas that we, as organizations of service, are able to give back to the community, so we normalize the conversations, that no one has to figure it out on their own, that you have the support, you have the resources, you have the
Right.
experts that are able to give you the information that you need. So we're huge on that educational component, and then bringing community together, because service is what we do. So sometimes there are moms that don't have access depending on their geographic location.
Right.
So how can we employ strategies that get these resources to them? And through our service engine of Z Hope, Zeta's helping other people
Oh, I
excel,
love that.
mind, body, and spirit, we're able to get that information to those who need it.
So, Dr. Grant, and just to reset here, I want people to understand that we are in the presence of greatness. Dr. Stacie Grant is the international president and CEO of Zeta Phi Beta Sorority Incorporated, and this is a phenomenal sorority. And as you've heard, and as we will continue to talk about how they are working within our community to help young women as they are navigating the canals of birth and childbirth. I'm sorry, of labor and delivery, and all of the things that go along with it. I wish, and just for a personal story on my part, Dr. Grant, I wish that something like this had been here when my grandmother was giving birth to my mother, because my grandmother passed, died giving birth to my mother. And when it came time for my mother to give birth to me, there was a difficulty. And but she had my uncle who was her obstetrician, and she had my aunt who was her nurse at Provident Hospital on the south side of Chicago. But and there was a problem. There's a fibroid that was blocking the canal, right? And so I wish that the conversations had been there and had been had in advance of my grandmother and whatever difficulty. And that was a long time ago. But still, just the fact that we're giving them, giving young women and some older women opportunities to have these discussions. You're doing it, and you're cradling them and guiding them and making them feel as though they are the chief medical officers of their bodies, of the lives of their children that they're bringing into this world. Cardiovascular disease is the leading cause of maternal death in the United States, or more simply put, heart disease is the number one killer of new moms. It can pose a threat to women's heart health during pregnancy and later in life, making it important that women understand how to care for themselves and their babies. Dr. Grant, I think this is the place for us to take a moment to connect with one of our female medical professionals. We'll be right back. Hello, everyone. I'm Sybil Wilkes of Yossi Media in partnership with the American Heart Association. And it gives me great pleasure today to have a wonderful, wonderful young woman who is going to lend her expertise to our topic. And we are talking about Black female mortality and maternal health. This is Dr. Bayo, Dr. Bayo Curry Winchell, actually. Dr. Bayo, or she has labeled herself Dr. BCW. I love that. Dr. BCW obtained her medical degree from Ross University, followed by completion of her residency at the University of Nevada in Reno. And you're still in Reno, are you not?
I am.
And when I tell you this woman is like the Jamaican of the group, she has a gazillion and one jobs, but she is. But just check this out. Just bringing it down a little bit. Dr. Bio is the medical director of two hospitals, not one, but two hospitals. You are a practicing physician, and you have time to give TED talks. So I don't know if and when you sleep, but you're a whirling dervish from what I've just been able to pick up just as we've been preparing for this. Thank you for taking the time, and I want to hear more about your story because you really embody what we're talking about. Had you gone through a health crisis before you became a doctor?
I had. And so, first I like to start with there is that lived experience just
Right.
being a Black woman of what I've experienced through the healthcare arena. But even when I've been a part of this work and doing this work, when we talk about Black maternal health, I'll share my story of what happened to me, even with someone who is advocating and been a part of this system for, years. So I had my second child. I came out of the operating room and I had a C-section.
Hmm.
And I knew I didn't feel the same way as I did before. I was having a hard time talking, concentrating. I just knew I didn't feel like myself. So I shared that with my nurse and I said, something's wrong. And she said to me, no, Bio, your vital signs are fine. Everything looks okay. So I waited a little bit longer and then it continued. It got worse. And I was like,
Mm.
nope, something is wrong. And so she said to me, she was like, everything's fine. This is how you should feel. You look fine. And those words are important to highlight. So then I asked my husband to call my OB on my cell phone for doctor to doctor. Of course, I
Mm-hmm.
had his number. And he said, something's wrong with Bio. Can you come and see her? So he did. And I'm so grateful, Sybil, that he listened to me. He
Yes.
took in that I was not myself. And that goes to that piece of, really taking in who is in front of you. What are they saying? And I was taken back to the
Mm.
operating room and found that I was bleeding internally.
Oh my God.
And so I almost died and I was transfused 4 units
I am
and
so
hospitalized for two
sorry.
weeks.
Oh.
So I share this story because we often hear it's socialized that it's access, that it's
Right.
an access issue. That's a part of this problem. But I had the most access in the world as a physician, as a medical director, and that didn't help me in that
Right.
situation.
Right.
And so it was important to me, even through all this work that I've been doing. Here I face, almost losing my life because of this crisis that is ongoing, that I wanted to share the information in hopes that I could save, one additional life. And
Yeah.
whether it's a patient or a clinician, to know more about really taking in what that patient is saying. What are the thoughts of what you think pain looks like? And
Right.
that's important to mention because, this nurse wasn't living in malice. I don't believe she was
Right.
trying to hurt
Right.
me, but in her image of what pain looked like,
Hmm.
I wasn't it. I didn't fit that. And
Because
that's why
to
it's been
her,
so
to
important
her,
to me.
her practice eyes, you looked fine, but
Correct.
she didn't hear what you were feeling, which wasn't the same as your first time around.
It's first rooted in, when I decided to become a doctor, it's titled, of course, Do No Harm. And
Hmm.
so every patient I see, I am really invested in listening. No matter what race or ethnicity that you are. And if I do see someone of color, there is this kind of course, understanding, this invisible understanding of what that person or that patient has gone through. And
Right.
so it starts with listening and taking in their journey and asking and being curious. And that's what I share with other clinicians who may not be of color. You can invest in yourself by helping other patients by being curious and listening and also knowing the history. So for my patients, it's a part of that. Also, as you know, I have a free health series called Beyond Clinical Walls, and it really combats mistrust. It also shares information because there's something to be said about when you have that knowledge that
Mm.
can really help break down that mistrust. And so for me, I thought, why not share health information as widely as I possibly can in a free format? And so you can find the series on all social media platforms, and it not only raises awareness, but it helps you know what to do based on whatever disease you may be facing or a loved one. And that for me is why I became a doctor. How
Wow.
can I help people wherever you are?
Barriers that we face, and how can they be overcome as you have experienced them? Because you've been on both sides of the
So the
bed.
first Yes, that is correct, And so the first thing I start with, which is non-traditional, is first, don't doubt yourself. Because I
Mhm.
think that's going to be that kind of through line, that throughput to help you navigate our system. Our system will continue to be racist and sexist and have issues. But I'm all about what can you do in that moment to get you through it. And so the first part is don't doubt how you're feeling, and if someone dismisses it, you keep stating it. You keep going forward and stating something is wrong. The other part is when you're having a conversation with a clinician, and if you feel like you're not being heard or listened to, I really recommend telling that clinician, because we all have, as I mentioned, bias, and we've
Mhm.
all had. I'll give an example. We've had a friend where we're trying to help this friend, and they're not receiving this well, and we're like, "What's wrong? I thought I was coming at you the right way and helping,"
Right.
and they're like, "That's not what I received." And so when you take that and you think about a situation with a clinician, that can happen as well, where that person is
Mm.
thinking they're there with you, and they don't know that they're missing a step, that they aren't with you. So sharing with that clinician, hey, you're not hearing me.
Right.
Give grace first, because maybe there's an opportunity to fix it. But if you still aren't heard, that's when I say keep going, keep advocating for yourself. And don't feel like you can't question. You have the right to know every step of your health journey. And for my patients, I am very transparent. I will share with you, this is what I'm thinking. This is what we're going to do. And one tip I always give that I think can carry you through, whether it's a pregnancy with any health issue,
Mhm.
ask that clinician after you share your symptoms how they ruled something in and how they ruled something out,
Oh.
because that lets you know, Did they take in all my information? And then you've got this information that you can research and
Hmm.
see if it fits. So those are some of the things that I think everybody should, hold on to as they navigate. And it's what I do even personally, for all my patients. I'm extremely transparent. When we get to meet someone and we get to know something about them, there's an automatic connection. And
Hmm.
so if you can do that through the health journey, even if it's uninvited, it can make a difference, because then that person is thinking, oh, yeah, I remember this person likes ice cream, or this person did this in their life. It
Right.
really sets them apart from everybody else. So, yes, that is, and I'll give another example. So, we were talking about the work and the drive and all the things that I do and
Hmm.
why. Well, all credit goes to my father, Bill Curry. And so he just recently passed away. He
I'm
was
sorry.
99. He was a World War II Korean and Vietnam War veteran civil.
Oh.
And I grew up helping communities that have been historically excluded, going to different events, holding up signs. I had no idea what the sign meant, but I knew I was standing up for something.
Hmm.
And I share that piece because that has created what I do now to this day. All credit goes to him. But throughout his life, I would share information about it. When I would go to the doctor, even as a physician, I knew I needed to find a way for people to connect with my dad and
Hmm.
know about this 99-year-old man who was more than just that age.
Right.
And so that is something I have put forward in my personal life as well.
Help us as people who are advocates to know what to do.
So having someone by you is huge. Having a list of, whether you're just seeing a clinician for the first time, a list of everything that you are concerned about. The reason why I say that, let it live somewhere.
Hmm.
Because if something happens to you, then there is a memory, a trail of all of the things that are happening that you are concerned about. Because unfortunately, if you are unconscious or something happens, you need someone to be able to speak for you. And sometimes that may be through writing, that may
Hmm.
be through a voice, or if you can have both. Think of how powerful that can be, not
Right.
only a written form, but also someone by your side. So when it comes to advocacy, writing down your symptoms, writing all the things that are concerning to you, continuing to push and have that advocate. And when you're not heard, you go and see somebody else and you
That's
keep pushing and asking questions and write down those answers, that you received, because then you've got this playbook to compare. This is what this person told me. This person didn't even answer my questions. I'm
mm,
not going to even go back there.
right.
And that allows you to memorialize what has happened, what is happening, and what you need to do
Whew.
to feel better.
You just need to let that rest there because that is so vital and
Yeah.
so very important. Let's talk about as we come to a close, and I want to thank you for your time. Why are we more at risk of not stepping up and letting our feelings be known? Do you think?
It's multifaceted. It's that history of being dismissed. It's the mistrust that we even have in the system.
Hmm.
So we often think, why should we even say anything? Or I'm just not going to even go to the doctor. There's also a piece of in our own families where I think often if it's mental health or other things,
Hmm.
we've all heard the term, we don't talk about that, or don't tell people your business.
Right.
And it's important I mention all these things because it's not just a one piece. So when you have all of that, and then you have a health system that isn't really inclusive, that has all of these barriers, that makes it very difficult to even just have an equal starting point to
Right.
navigate the system. And, when you continue to be dismissed and feel like I'm not a part of, I shouldn't be valued, my health isn't valued,
Hmm.
it makes it very difficult. So I think this issue will be ongoing, but investing in the tools that what you can do with any health topic, because I am a true believer that your health is your most prized possession.
Amen.
And so honoring that, embracing that, and pushing forward, whether it's in your family with that narrative, oh, you deserve this, or I'm going to come with you, or
Mhm.
don't be ashamed that this is happening to you. Or when you're in the doctor's office, I want you to tell me more. Tell me why you decided that. I'd like to see somebody else. So you see where I'm going with that
Yes.
two-part system.
Yeah.
And I think if we can find a way to package that together, that will really move the needle. And that's why I decided to do what I did with the series. I have a
Oh,
wide
okay.
variety of topics out there, just telling you, this is what you can do.
Mhm.
And it's every video and everything that I do is instilled upon this is your healthcare journey. And one of the best compliments I've ever received is it's not me talking at people, it's sharing the information. Because whether you are on a journey of traditional, non traditional, whatever is important to you, I just want you to have the information so you can choose what you want to do for
Mhm.
yourself.
Yeah.
And that's what healthcare should be about.
You are a real inspiration, Dr. Bayo, and I want people to be able to go and see your videos and to follow you on social media and to see your videos. How can people do that?
Thank you. And thank you just for having me. Please check out my website, drbcw.com, which has a wealth of information. I'm on Instagram, TikTok at dr_BCW, and all videos are free. I also have a podcast, Beyond Clinical Walls, on all of the major platforms, and a YouTube channel
Mhm.
also with
Awesome.
Beyond Clinical Walls. So lots of information. And please check out my TEDx talk, Do No Harm,
Do no harm.
on maternal mortality. It shares Serena Williams' story. It shares my story and other women, not only raising awareness about it, but giving solutions. And so I would love for everyone to please check it out.
If ever we had someone who encouraged us to be the chief executive officer, medical officer of our bodies, it's you. I thank you for your words of wisdom, for your passion, for your insight, and for your caring. And I just want to tell you one more time, your daddy done good. You are just a truly incredible human being. I want to thank you for your time. And I think that people will come away from this energized and inspired by you and your words and your actions. Thank you so much. You really are a true inspiration. Black women face a greater risk of developing high blood pressure, having a stroke, or developing complications during or immediately after pregnancy. Dr. Grant, that was a great conversation with Dr. Bayo, also known as Dr. BCW. So, what do we have in terms of resources for women that have difficulties due to their geographical locations?
We have vouchers that assist women who have
Mm,
transportation needs,
right,
right, in order
right.
to get this information, to be able to sit down and to have a support system. We give them these vouchers through our program so they can get the access to the prenatal care that is critical for ensuring a healthy pregnancy and birth. So this birth equity initiative addresses the transportation needs, it addresses food insecurity, and then lack of baby supplies. So these are
Mm,
the things that when you're in a geographical location that you don't really have access to go down the block or up
right.
the hill, how do we fill that gap? And we are proud that our founders 104 years ago
Mm,
understood what it meant to really be a part of transforming lives and communities, speaking out against social ills, representing a voice for the voiceless. And
yes.
104 years later, we are still doing that and committed to making sure that wherever our chapters exist, we're partnering with those who have the resources, the education, the finances, to really transform how people live. It's our basic human rights that are at stake.
Yes.
And with our ability to give these vouchers, we are just assisting them in one of the most joyful moments of their life to be able to carry a child and to bring a healthy child into this world.
So, just as someone who may be in a distant community, but there may be a chapter, a Zeta Phi Beta chapter somewhere, they may have heard or someone may have passed the word. Can they contact your local chapter and get these vouchers?
They can contact our chapters through our Stork's Nest directors, or they can go to our website, Z5B 1920.org, and they can find out where our chapters are. All of our chapters don't have Stork's Nest. Some of our chapters have this programming that we're doing. So we would just have to connect them with the closest one to them
Got
so
it.
that they could get those resources. And I know that you will put that in the follow up of the show on how they can contact one of our directors who can put them in contact with the closest chapter to their geographical location.
Got it. You are a service-focused organization, as we know, and you are there to serve, and you are a great leader and example of that. Um, and we talk about the opportunity to give vouchers and provide medical care and instruction for women. What strategies for those of us that are not a part of an organized organization, such as the great women of Zeta Phi Beta Sorority Incorporated, what are the strategies that we might be able to employ to assist those who are kind of struggling at this point?
I think there's always opportunity to do some of what I call the grassroots approach.
Yes,
Just know who's in your community, right?
yes.
Talk to your neighbors. We've come
We
away from
don't
some
do
of the
that
basic
anymore, do
ways.
we?
It's just this really, it's not rocket science. Like, who in your community, if you're talking to your neighbors, then you know that Mr. Wilson's daughter is now married and they're having a baby, or Tommy down the block is a new dad and you're going to meet the fiance or meet the mother of his child. It's in conversation in your local community. It doesn't have to go so far past your block, your apartment complex.
Hmm.
Talking to people to find out what's going on in your localized community. Maybe it's a apartment complex and there might be 2 or 3 expectant mothers. It's
Mm,
asking the question, how can we support you? Can we organize a community baby shower?
yes.
And the community just comes, and you might not have finances as a community resident to buy a crib, but maybe you can contribute $5 towards some Pampers, or
Hmm.
you could maybe give them a gift certificate for babysitting hours. Being creative with how we approach what community looks like, we have to take that back. And I know that COVID did a number on so many ways in which we used to interact,
Yes.
but we need to bring back those tried and true principles of just knowing who lives around you and what do they need. It doesn't have to take $1 million to get it done. It just needs to take a heart willing to care
Mm,
about who
mm.
is around you. And if you see someone that you might not have known that they were expecting, but then it becomes
Yeah, because you can't
obvious,
ask
just a
these
quick
days.
hello. No, you might get yourself in a lot of trouble.
Right, right. But if you hear that they
So
are,
if you hear that they are, say, how can we support you here in the
right.
community? Do you know about, and then maybe there's a community center that you can let them know that there's some resources there. Maybe they are unaware of a church that might have some
Mhm.
outreach or some programming that they can go to. And they could also learn about organizations like the Divine Nine who provide these sorts of resources for them. So if you're not connected or involved, you're still a valuable member of our community
That's
and
right.
you have a heart and you have a desire to help. Don't complicate it. First, start with a conversation, build a relationship, and maybe just saying a kind word, because every woman has a different experience in their birthing process.
That's right.
Some have really challenging pregnancies. I had a very challenging first pregnancy. I was sick for the first 2 trimesters. It was
Oh,
horrible.
oh my.
And then I couldn't eat. I lost weight in the in
Mhm.
the first 2 trimesters. So
Right.
I wasn't the happy, smiley new mom, but
Right.
someone just saying something kind could make a difference. So, Sybil, let's not complicate it. If you're in an organization, then go ahead and move forward with the initiatives and the resources that we have prepared. But if you're not, find out about an organization you can partner with or create your own opportunity for a conversation with a Black woman to know that they are the chief executive officer of their life, their body, their family. And we want to make sure that every mom has an opportunity to have a successful pregnancy, deliver a healthy baby, and no complications once they are home, because postpartum is real.
Great point, Dr. Grant. And next, we have two guests who are going to share their own personal experiences. Stay tuned. And we are here with a Go Red survivor, Marian Dancy. Miss Dancy, thank you so much for joining us. How are you today?
Thank you for having me. I'm doing so well.
I'm glad that you're well, and we do want to talk about this. And so our focus is not only to talk about Black maternal health, but also to get the success stories and tell your personal story as a Go Red survivor and what happened to you. You are a mother of how many?
I'm a mother of four beautiful children.
Oh, bless your heart. You're a busy woman too.
Yeah, I am. Very busy,
And
very busy.
And so, after your fourth child, I believe you had an event that really kind of changed your life. Can you kind of take us through that?
Absolutely. So my heart journey began at the age of 35. I gave birth to my fourth child, a beautiful baby girl. The pregnancy went well, delivery went well. We were living our lives. And then about 6 months after having her, I started to experience some symptoms, fatigue and swelling. But I thought, I'm a busy mom. I need a vacation. I'm a little bit tired and run down. And it was something that was normal for me to be tired. It wasn't
Mm-hmm.
until my going to work and I temporarily lost my vision at work for just a few seconds. And that
Mm-hmm.
prompted me to make an appointment to the doctor. And that was my first of several appointments that I had to make. I went
So
to that first
you
doctor.
you were I'm sorry, you were at work and you were doing whatever it is you do in your normal day, and your vision, you lost your vision completely.
Yeah. Yes. So I actually took the elevator down to the cafeteria. So it was me getting off of the elevator. And as soon as I stepped off, it just went black. So I stood against the wall. I didn't know what was going on, but it only lasted for a few seconds. I
Mm-hmm.
knew it was something that was not normal though. And
Sure.
being tired and having that fatigue and that swelling every once in a while, I knew that, okay, I should go see a physician and see what this is about.
So things started adding up for you.
Yes, yes, it did. The symptoms started adding up. I did make that first doctor's appointment. And when I went, I heard, hey, there's nothing really in your family history. You're young. I was 35 at the time. And let's just keep an eye on it and see what happens. There was nothing too concerning. So I left there with no answers, but
Mhm.
it didn't get any better for me. It began to get worse, actually. I started experiencing congestion and some other symptoms like muscle fatigue, along with the swelling and the tiredness.
Mhm.
And so I knew that, okay, hey, maybe I need a fresh set of eyes. So I made a second doctor's appointment with a different
Good for
physician this
you.
time. Hmm.
Mhm. Mhm. And that's not to take anything away from your doctor. Obviously, you felt very comfortable with this particular doctor, and I don't know. This may have been the doctor that delivered your last child. What
Yes.
did you have that kind of relationship?
Yes, we had a great rapport, and it was the physician that delivered my child. So I was comfortable, but it just wasn't an in-depth look when I went. And I said, okay,
Hmm.
this the second time around, I don't want to hear I'm young and healthy because I know I'm not feeling okay, and I know that there's
Right.
something going on, and I need to figure out what it is and why I'm feeling this way.
That's key, and that's what we're talking about because you became the chief medical officer for your body and pursuing an answer to what was going on with you. And so, what happened with the second opinion?
With the second opinion, I heard similar words. There's nothing in your family history, and there was a virus going around. So just keep an eye on it and give it a couple of days and see if the symptoms pass. But they didn't.
Mhm.
The symptoms did not pass. They became more severe, and my everyday life started to be affected. And I was caring for my 4 children. I was still going to work at this time, involved as a sports mom and all of those things. And I was kind of just pulling myself along. And I knew that didn't feel right to me. So I went on and I said, hey, I think I need to go back in. So this time I dragged myself to the ER.
Oh, wow. Dragged yourself. Like you were
Yes.
at that stage where okay. Did you go
Yes,
alone?
I did go alone. At the time I was married, and that we had all the children. So it was kind of like splitting tasks. So I
Sure.
did take myself to the emergency room. And once I got to the emergency room, a few tests were ran and they came up with a diagnosis of pneumonia, which was unfortunately a misdiagnosis for me. Yes. So I started to treat myself after leaving the ER for pneumonia, and my health severely declined after that. All of the symptoms that I had been experiencing up until that point, they were just way worse after that ER visit.
So this is like the fourth medical visit you've had, right? With someone,
Well,
with your primary physician, then you went to a second person, and then you went to the ER. Okay, so is
yes, the
that
ER was my third
okay?
visit. Yes. So that third visit, after that third visit, like I said, my health declined severely after
Mm,
that. And so I finally, for the first time, took a sick day off of work. Up until that
mm,
point, I had been going on with life, but I couldn't take it anymore. I took a sick day and I said, I know this is not right. And I
right.
felt this feeling that if I don't figure this out, this is going to be it. So I got
Mm,
my insurance card and went to the back of the insurance card and called the assistance line to get a referral to a new physician.
wow. My goodness. And if not for your persistence, I shudder to think what would have happened. And so when you called your insurance company and you spoke to someone, how did were they then able to guide you in the right direction to someone who helped you?
Yes. So, well, initially I called that helpline to get a referral, and it was a week of Thanksgiving. And so there were a lot of
Mm,
physicians that were out of the office. And so
sure.
the representative told me, hey, we might have to push this out until next week. And I said, this can't wait. It cannot
Hmm.
wait. So the representative kept looking for me and found one appointment and said, hey, this appointment starts in about 20 to 30 minutes. Do you think you can make it
I'll
there? I
take
said,
it.
I'll take it. I will make it. Where is it at? I will make it. And at that point, even walking was laborious for me. It was hard to do
Mm,
just basic tasks. And yet still, I knew I had just a few moments to get to that fourth appointment. And so I made it
mm,
there. I drove myself to the appointment. And it took me a while. Once I pulled up in the parking lot, I said, I don't know if I can make it into the office, but I
mm.
did. I did. I made it into the office, and I'm so thankful that I did. I sat down, and the nurse ran tests on me, did an EKG, and she rushed out of the room, left me sitting there, and brought the physician back with her. They reviewed the results, and the physician said, hey, I don't mean to scare you. I think I'm seeing a case of heart failure. And from
Oh my
there,
goodness.
yes, it was frightening. But from there, I was admitted to the hospital.
But and so there is a period I can imagine. I would think I'm just guessing here, but there's a period where you're like, oh my gosh, heart failure, and yet now there may be an answer to this,
Yes,
right? So
both.
there's it's a little
Yes.
bit of this, and yeah, yeah,
Yes,
yeah.
it's relief to have an answer, but
Hmm.
I was lacking education about heart failure at the time. So for
Sure.
me, I said, am I going to make it out of the hospital? My
Yeah.
kids are at
Right.
school right now. What am I going to do? Like, what's next? And what does
Right.
this mean for
Right.
me?
What is the final diagnosis?
My final diagnosis is peripartum cardiomyopathy. So my pregnancy caused the heart condition that led me into the initial heart failure. It is important to have those conversations amongst family, amongst friends, your sister circle. Self-care is more than looking good, right? It's more than having your hair and your nails done. It's about the things that you can't see sometimes, right? So I think that I do stress to my girlfriends, hey, you need to rest. You have to say no sometimes. We are, we're women that wear many hats. I have a career and, I'm a go-getter and want to do well in that. But I know I have to take time for myself first.
Thank you so much for sharing your information and your time with us. I appreciate it. It's been a pleasure to talk to you and to hear your journey. And you continue to be well and spread the good word.
Thank you so much, Sybil.
Hello, I'm Sybil Wilkes, and we are continuing our focus on Black maternal health. My company is Yossi Media, and we are working in partnership with the American Heart Association, and we are talking to women all over the country about this very, very serious issue about Black maternal health and making sure that Black women are the chief medical officers of their lives. Joining me today is a Go Red survivor. And Leslie Jordan, welcome. Thank you for joining us.
Thank you so much for having me. I'm so honored to be here today.
The honor is ours. You have an incredible testimony and a story to share with us. Leslie, you you have been through pregnancy. How many children?
Actually, just one, my son. So just one pregnancy, my first
So,
time.
and that was enough. That was enough. I
And
having
that was enough.
scoping out a little bit about your story. So, Leslie, tell us, how did you come to be an ambassador, if you will, for the American Heart Association? What happened to you? And tell us your story as you were pregnant with your son.
Well, I like to think that everything happens for a reason.
Mm-hmm.
So my first pregnancy with my son, it started out as a typical pregnancy, but towards the third trimester, I was diagnosed with preeclampsia. And I've never heard of preeclampsia before. I got the brochure and I read over it, and my OBGYN at the time, they were very knowledgeable and they walked me through it and make sure we did everything to try to prevent most of the risks that can come with preeclampsia, such as stroke or heart cardiovascular issues and major organ shutdown. So I knew that it was something serious, but it just didn't seem like it could happen to me because I've never had any issues with my health. I barely even had to take vitamins, my vitals, my blood work. Every time I did a yearly checkup, it was
Mm-hmm.
always normal. It came back fine.
So you're in your third trimester, and you discover, and the doctor tells you that you have preeclampsia. And what happened then?
So it was a day indeed. So for 48 hours, I was in the hospital after I delivered. Keep in mind,
Mm-hmm.
I just delivered, and there was a headache that suddenly started creeping slowly and slowly. And I noticed that the pain would not dissipate. It just kept getting worse and worse to the
Mm-hmm.
point where I felt like all the gravity had left my body. I felt my head had like a bowling ball or like a house because I couldn't lift my neck muscles up. My
Mm.
neck muscles gave out, and to the point where I had to get assistance from nurses and aides just to get up out of the bed, to get to the bathroom. And I'm thinking in my head, okay, I just had a baby. I don't think this is normal, but
Mm.
this too shall pass. However, I'm going to let them know how I feel. Of course, they ask you how your pain levels are. Is it 1 to 0, with 10 being the most painful it could absolutely be, and 0 not really any pain at all?
Mm-hmm.
I said it was beyond a 10. It's a
Wow.
thousand, whatever you need to call it. And so I kept getting prescribed medication because they were just treating it like, oh, a headache. Okay, your head hurts. You keep
Mm-hmm.
saying your head hurts. And once the medication just kept getting stronger and stronger, there was no change in the amount of pain that I was feeling. Now, keep
Mm.
in mind, I have a bubbly personality. This is just the
Mm-hmm.
way I'm born.
Mm-hmm.
So even when I don't feel well, because I still have to deal with pain management, I laugh through it. I choose to smile. I have
Oh.
moments where I cry, but I would just be happy and smile and say, okay, this hurts, but I'm going to be okay. And so I don't know, maybe it wasn't interpreted that the pain was that serious. And that's why I say on the 48th hour after I experienced a thunderclap headache, that's what I know it was now, it's a thunderclap headache. And if you have one, go to the ER, go to a doctor, urgent care, you know, immediately.
Mhm.
And she looked at all my medications. She did the standard thing that all the other nurses did, no different. But when she looked at my medication chart, she said, "You're taking this, you're taking that, and this." And then the
Mm.
next thing I know, she ran into the hallway. She was yelling as loud as she could. Profanities were going. And I'm just like in the bed, like, I cannot move. I'm in pain. I hope I didn't like offend anybody because I'm trying to get out of here
Oh,
alive. Like, I'm trying to survive.
oh, honey. Oh.
And so she comes running back in the room, and it could have been any doctor, but she was a neurologist. And by the grace of God, when the neurologist came in there, I felt a sensation all of my body, like my body was on fire. And I think it was worse than the pain of delivering.
Oh.
And I was like, oh my God. And I could hear my speech slurring as I was trying to communicate. And I
Mhm.
said, as loud as I felt myself, okay, I'm having a stroke. And so I said, I don't know what I can do for myself right now, but I'm going to yell. And so I yelled as loud as I could, I am having a stroke. And the doctor or neurologist, his eyes got so big. And then the next thing I know, I blacked out.
Wow.
And
Who was with
I
you at
woke
this
up.
time?
I want to say my husband just left. I
Okay.
think he went to go get me something to eat or something like that. Because keep in mind, like my mom, my dad, my
Mhm.
mother-in-law, my sisters, like everybody's been in and out of the room, in and out of the
Mhm.
room. The baby's
Mhm.
been in the room, been out of the room. You know, I did have assistants. So I was never typically alone, but I guess
Right.
they felt like, okay, let me just run out and run back.
I'll be
And
right
so
back.
my assumption is once, yeah, and you know, we're not thinking anything major is happening. Maybe I'm just in pain and I'm going to get better. And all I know is that when I woke up, I was in the ICU, and I didn't know where I was.
Mhm.
All I know is when I tried to move, I could not move. I was paralyzed.
You have been seen, you have been heard today, and I thank goodness and thank God for you, for sharing your testimony. And I wish you nothing but clear skies and good health for the remainder of your days. And enjoy. Go hug on that little boy all you want. You've earned
Yes.
that right. Thank you so much for sharing your story.
Thank
You're
you.
wonderful. Women of color experience unique risk factors that can affect their maternal heart health. The American Heart Association and Go Red for Women are fighting back for increasing awareness, advancing research, driving policy change, and improving clinical care. Joining me today is the international president of Zeta Phi Beta Sorority Incorporated, and that is the one and only Dr. Stacie Grant.
First, my condolences on what your family had to experience because they didn't have the proper support and information. And I know that's why it's personal to you to make sure that no one, leaves this earth prematurely for
Right.
lack of information. And that's what's so important as a service organization, why we've made this commitment.
Oh, Dr. Stacie, you've been so wonderful. I hope that people, and we'll tell them in advance, to take notes because this really is a class. It's a master class on what you and your organization, Zeta Phi Beta Sorority Incorporated, are doing to help us become the chief medical officers in our lives. You've given us our marching orders. You have given us beautiful examples, and now it's incumbent upon us to carry out those rules, those instructions you've given us to go out and to share the word, to spread the word to every person that'll listen, whether you're pregnant, talking about getting pregnant, whether you are running around with little ones, wherever you are in that stage of life, to go out there and to be the advocate for each other. You are a beautiful example of that. And the women of Zeta Phi Beta Sorority Incorporated are so lucky. They're blessed to have you as their leader. Thank you so much.
Thank you, Sybil, for this opportunity to have the conversation. Let's not overcomplicate it. We can save one life with one conversation. And thank you for opening up this platform so it can be shared in partnership with American Heart Association. I'm excited to be here and excited to see how many other healthy babies come into the world with the right kind of support as a result of this conversation.
Thank you so much, Dr. Grant, for spending time with us today. I've so thoroughly enjoyed our conversations about maternal health and especially about Black maternal health. I believe that this will not only increase the conversation for women's maternal health everywhere, but it will make a difference in women's lives. And as we close out our program, we now move to a conversation with an executive from the American Heart Association, Pamela Garmon Johnson. Pamela Garmon Johnson, you are here and talking about health equity and American Heart Association and all the great things you do. And what we are talking about in this program is being the chief medical officer of your life, encouraging Black women to do this. What is your best advice? How might we best go about becoming the chief medical officer for our lives?
I actually coined this term last February, and I shared it with this group of women in Georgia. And I've just carried that forward about being this chief medical officer. And what it means is being empowered and educated,
Mm-hmm.
and and being able to advocate for you to be heard. You heard me talk about that a little earlier about being heard, but to have action taken. I've personally have gone through a health crisis, and I wasn't being heard. I went to at least 20 different doctors, and no one could figure out what was wrong for me. I mean, I've been tested for so many things, but I commend this one physician that said, you know what, Pamela, you need to see this specialist. She has many studies around Black and Brown women, and I think she could help you. There was a cancellation. I went in to see her, and I promise you, when I got through my crisis and actually the condition that I had totally dissipated. In my last appointment, when she said, "You don't have to see me anymore," I mean, I had tears and I hugged her because the journey that I had been on to be heard and action taken was such a relief that it wasn't just in my head. I mean, I physically could see that there was something wrong, but Sybil, just that's why you got to keep pushing until you get the answer. And so that's what it means to be the chief medical officer. Don't give up. Don't just throw your hands up and say, well, it's just going to be that it's going to be.
Right.
No, you want to be able to find the solution for you. And so you have to work to find the right provider that will be in a relationship with you so you can be better. And it was July the 8th. And my doctor told my husband and I, well, we really need to induce. And I was like, okay, let's do it. And so I went in, I was induced, and I still would not dilate, Sybil. I mean, I was just like, I was stuck at like 2 to 3 centimeters. And I said, oh my goodness, what? Oh my goodness. So anyway, I kept saying, I don't want to be cut on. Right. I don't want to have a C-section. Right. And I was like, well, Pam, if you don't dilate, we may have to do that. I said, I don't want to. And I really pushed for that, Sybil. And literally after about the 6th or 7th hour, when I tell you I went from like 4 to a 9, it all within like an hour.
Wow.
I did. And I delivered our son without I didn't even push for 10 minutes. Mm-hmm. He came and oh my goodness, but I pushed because I knew there was nothing else. My blood pressure wasn't high. There was no reason for them to perform a C-section, but you know that we tend to have more C-sections than other groups. And I recognize that if there's not anything where there's trauma with the baby or trauma, or you're not in, it's not a life threatening situation, then let nature take its course.
Mm-hmm.
And that's what I was advocating for. Let nature take its course. Clearly, he wasn't ready at that particular time,
Right.
but when he got ready, he came
Okay.
when he was supposed to.
Right on time.
So, and that's not, that may not be the situation for everyone, Civil, but I was in a situation where there was nothing else wrong. It was a matter of about time. And sometimes we do have to put our foot down when it's what we feel like is best for us.
Yes.
And we have to demand that.
You are obviously the one who is responsible for leading the strategic planning for improving the health of communities across this country and so vitally needed, and identifying the opportunities for partnerships to affect the transformative lifestyle and community change. And you are the woman for that job. Thank you so much for joining us today. Appreciate it.
Yes, as we conclude this transformative summit dedicated to Black Maternal Health Week, I want to underscore the imperative for Black women to reclaim their roles as chief medical officers of their communities and in every space they inhabit, whether it be where they live, work, play, or pray. For far too long, the voices, experiences, and expertise of Black women have been marginalized within the healthcare system and the decision making process. Yet, we are the pillars of our families, the backbone of our communities, and the drivers of change. It is time for us to seize our rightful place at the forefront of healthcare, advocacy, policy making, and leadership. Let us commit to amplifying our voices, advocating for equitable access to care, and nurturing a community of empowered, informed health advocates. Together, we have the strength, the knowledge, and the resilience to redefine the narrative surrounding Black maternal health and ensure that every Black woman receives the care and support she deserves. Thank you, thank you, thank you. Thank you for this partnership, Civil. We are making a difference and we look forward to continuing our work together.
I stand here amongst a great group of women, and we want to thank them for their participation and their action in today's program. Our partners at the American Heart Association, including Brittany Glover, Angela Collins, Katrina McGee, Pamela Garmon Johnson, and Arika K-san. Our special guest, Dr. Stacie Grant, president of Zeta Phi Beta Sorority Incorporated, Dr. Bayo, our two Red Women survivors, Marian Dancy and Leslie Jordan, and of course, my team at Yossi Media, Cherie White, Chica Chickadilly, and Yolanda Starks White. And thank you for joining us today.